Can I run something by you really quick? Do you have time to come look at this rash with me? How have you handled situations like this in the past with your patients? What things do you wish that you had known earlier in your career? If you've asked for help from colleagues or realized that you needed to, please stick around. This episode is for you. Welcome to the Med Ed Well podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stejink, a practicing general pediatrician and online entrepreneur. Thank you so much for joining me here on episode 27 of the Med Ed Well podcast. Thank you so much for listening, for subscribing, for sharing, and for engaging on social media. But today, we're going to be talking about asking for help from colleagues in 4 different ways. We're talking about asking for help and why it matters both for personal and for professional wellness. We'll be looking at asking for input and advice, help when you have high clinical volumes, for coverage when you have time off, and for coverage in emergencies or difficult situations. But before we get into the rest of today's episode, let's hear from today's sponsor. Getting a financial education seems daunting until you realize that you did way harder things in medical training. The White Coat Investor has been promoting financial literacy for doctors since 2011 and has great courses to help you make a financial plan, evaluate financial advice, and pursue your wellness. CME is included on some of the courses, making them a perfect fit for those unused professional funds. I have personally taken the Fire Your Financial Advisor course and found it super valuable in my own financial education. I encourage you to visit the link in the show notes and consider signing up for a White Coat Investor course today. All right, now back to today's episode. Medical training can be isolating. Beyond the cliques that form from study groups in the first year of medical school, there are varied rotations during 3rd and 4th year where you are expected to know all the answers about your patients and the rest of the team's patients. And does real collaboration help you stand out for honors in those situations? For letters of recommendation? Especially with limitations on learners at times during the pandemic? From medical school, through training, and after, medical training, particularly for physicians, has been very individualistic. Get your stuff done, highlighting individual achievement, and the list could go on. It can be easy to forget or just miss the value of collaboration, community, and colleagues. So how can we build some of those connections, that interdependence and collaboration? By asking our colleagues for help. So we're going to talk about 4 different ways that you can ask for help from your colleagues and how that helps your wellness. So the first area is clinically. Like we talked about in the intro, maybe they come see a rash with you. Maybe you ask for a second opinion as you have some undifferentiated exam finding. Maybe you discuss a particular clinical scenario. What's your current practice for this particular condition? How do you handle this difficult family social dynamic or give unexpected news like this? Personally, it's been super helpful to have senior colleagues in my office, especially as my residency program, like many, have a high emphasis on inpatient medicine rather than ambulatory. It can also be helpful to have input from colleagues around career advice, mentoring. They could be a few steps ahead, or maybe even one of your peers, but just has done some stuff that's been different from your experience and you want their input. It could be what to look for in a job, clinical practice, leadership opportunities, or their experience going through burnout. So first, ask your colleagues for input and advice clinically, but then second, ask them for help when you have really high volumes. I found it helpful to check in with my colleagues from time to time, whether in the hallway or the workroom. Just say, "Hey, how are you doing?" It's open-ended and caring. There may be something else going on, but maybe they just sent a patient to the emergency department and now they're behind in clinic, and you jumping in to see a patient for them would be really appreciated. But I ask, "Hey, do you need me to see one for you?" And then let them respond. Shuffling patients around, yes, at times staff doing it can be totally appropriate, but sometimes having the physicians and nurse practitioners have input together can be really beneficial. Not only for the workload, but also for trying to maintain continuity. Maybe it's unifying a visit for a family that has siblings scheduled with 2 different people. Maybe it's, "Oh, I saw that you've seen this patient for the last 2 years. Do you want to see them? Or do you rather me see them once and then send them back to you?" Maybe it's different languages. I personally speak Spanish, and others in my clinic speak Farsi and French, so maybe there's some ability to make the patients feel more comfortable by speaking in their preferred language rather than having to use an interpreter. It's not always possible, but when it is, it may be good for the physician and for the patient. So with the high volumes, checking in, caring for colleagues, and showing some flexibility. It's part of how each of us need to ask for help, whether it's for input and advice with high volumes in some of these situations, or number 3, when it comes to taking time off. In episode 15, I talked about taking your time off. And when you do, you need to actually be off. Try not to log in to the system, the EHR, your email. Let your colleagues cover your messages and your paperwork. Ask them, "Would you be willing to cover my inbox this particular week?" And then offer to cover theirs. Volunteer when needs come up. And keeping that serve first mentality can really be an opportunity to say, "Hey, we are a community, we're a family." And even if you're not, it still gives you an opportunity to be away and to not feel like work is coming after you all the time. Email in particular has been especially hard for me. So I had a few weeks off a couple months ago where I checked because I knew open enrollment was coming, but otherwise I didn't check it. Previously, I had it on my phone and I checked it a lot, even sometimes on vacation. But after a months-long disruption to email in my system and hearing about a colleague who never puts work email on their phone, I realized I could get by without it. I'd check it when I was at work and catch up on things, but when I was off, I was off. And so I didn't put it back on my phone. And it's been great. So asking colleagues for help. First with input and advice clinically, with high volumes of patients. Number 3, when you take routine time off. And number 4, in emergencies or other difficult situations. Occasionally, family emergencies happen. You may need to leave work relatively quickly. You may need coverage, telling only those who need to know or that you feel comfortable with. But even some of these urgent but not emergent situations, sometimes by just asking, maybe your colleague would see your last patient so you could go to something that you really would benefit from being able to be supportive for someone else around you, whether it's a family member or a friend something came up and it's about caring for one another. Maybe clinically things are hard. Your patient passed away, or you had some other hard outcome, and you just need some time to reflect, to take a moment. Maybe your colleague sees the next admission, or maybe there's some other way that you can maintain coverage and just have a time to process, to acknowledge that you are a human and these things are hard. Physicians and other medical professionals are still human beings. We need to remember that, caring for ourselves and for each other. So I want you to take a moment with me and pause. Imagine what it would look like if you asked colleagues for help, for advice, for help with high volumes, during your planned time off, or in hard or emergent situations. How would you feel if, by asking, colleagues offered that assistance? Could it improve team culture, making you feel like you had each other's backs? That you're not just a machine churning out procedures and visits, but actually a real human being. Personally and professionally, these things boost wellness. So take that next step in your wellness today. Thank you so much for joining me here on episode 27 of the MedEd Well podcast. Please subscribe, share this episode, and leave us a review. You can also follow me in social media over at MedEd Well on Instagram and Twitter. If you need a course to help you with your financial wellness, check out a White Coat Investor course. Some of those even include some CME. Most of all, thank you so much for all you do, caring for patients and others in our communities. Please come back and join me for the next episode, and have a great day. And now for our important disclaimer. Dr. Ryan Stejink is a practicing general pediatrician, but the MedEd Well podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEd Well podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEd Well podcast, and have a great day.